Dr. Henry and I will again be briefing here from Victoria, from the Press Theatre here in Victoria at 3 o'clock. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. Today we have a new record high number of cases who have tested positive, 139 people in British Columbia, bringing our total to 6,830 people who have been diagnosed with COVID-19 here in British Columbia. That includes 2,343 people in the Vancouver Coastal Health Area, 3,551 in the Fraser Health Region, 187 people in the Vancouver Island Health Region, 642 people in the Interior Health Region, 203 people in Northern Health, and 84 people who normally live outside of Canada. We now are up to 1,412 active cases in every health authority in the province, of whom 42 people are in hospital, 14 of whom are in critical care or ICU. We have no new deaths to report today, leaving our total at 213. We now have continue to have 3,109 people now under active public health monitoring because they have been a close contact of a case, and we have 5,190 people who have recovered from COVID-19. We have no new healthcare outbreaks to report. There are 16 currently active in our healthcare system, 13 in long-term care or assisted living, and 3 units in acute care. And we're up to 773 people, 466 residents, and 295 staff who are involved in those outbreaks. And while we have no new community outbreaks to report, there are continuing ongoing exposures in many communities around the province, and we encourage people to check regularly with their health authority websites for alerts and guidance around community exposure events. Living with COVID-19 in our communities is the challenge that we are going to face for the next months, maybe years, and we need to continue to find a balance. This balance requires us to do what we need and everything we can to protect ourselves and those around us, but to ensure that we also have those activities that we need in our communities to keep going. Since the start of the pandemic, we have adapted and learned many things, and we've created a new normal that we are now living in and will need to continue to live in. It doesn't stop here, though. We will continue to learn and adapt as we move forward and to make adjustments. And what we have tried to do and what we will continue to do is make adjustments where we see that exposure events continue to happen where risk is. We know what we need to do to keep ourselves and those around us safe. And now we are getting ready for what may lie ahead as we head into respiratory season, as we start to go back to school and back to work. We need, and this is our time, to be steady in our actions and ready for what lies ahead. This is the time to use our layers of protection that we know and to always stay home and away from others if we are feeling ill ourselves. Today, for many, many children around the province, it is the start of school, the first day back. And I know for many children and families this can be exciting and anxious, no more so than this year, as we and millions of children around the world are going back to school in the midst of a global pandemic. I remember what it was like for me and my sisters as when we were young. But it's also a time where we all need to step back and set those new routines for our new school year, for the new phase that we're moving through. Over the past few weeks, education leaders, teachers, public health experts, all of us have been working together to create the new rules for school to reduce the risk of COVID transmission and, importantly, allow everyone to get back to that all-important in-classroom learning. As is the case for every school and every school district, public health teams are ready and will be there to support your school community as we need to going through this. And like we have in every previous year, we'll be there if a communicable disease arises that can spread to others And we know we've had those in the past. We've had measles, we've had meningitis. We will deal with COVID as well. And the school community will know and be alerted. And if there's the potential that risk goes beyond the school, then the public will also be notified. These are protocols that we have used in the past, and we have updated them and made sure that we are ready to support every school community, and every community in BC as we go through this pandemic school year. We will be announcing, as we've mentioned before, any school outbreaks as well, so that everybody knows what is going on as our school system goes back to normal, our new normal, and our new school. I think it is important for us to recognize all the work that has been done by educators, by our teachers, principals, the parent-teacher associations, the school districts, to get schools ready this year. And it's going to be a learning experience. Today was day one for many children, and we will all be learning over the next few weeks. And we'll be doing this together and working together to control a common foe like we have with this COVID-19 builds our resiliency and is what will get us through. It is incredibly important about keeping our community wellness and finding that balance. That means keeping our communities healthy and resilient, about using our layers of protection and staying safe. It's also about keeping those important activities that are safe going as well. It's equally important for our social, mental, and economic health. Every day we learn about COVID-19. We know about the sources of transmission, the actions we can take to protect ourselves. And there are many, many resources that are available to guide people's actions, and I encourage you all to make use particularly of the BC Centre for Disease Control website as your source of truth. I know there are many, many things that are out there, particularly on social media and on the internet, and the source of truth can help you find where to look for that information. What we are, all of us, every single one of us does today makes a difference. It makes a difference tomorrow. It makes a difference in the next 2 weeks, in the next incubation period, and for our future. By choosing to wash our hands regularly, by choosing to keep our social interactions small and with those we know, and always, always staying home if we're not feeling well, we will ensure that we remain strong here in BC. So let's all make those right choices that will help to keep our cases of COVID-19 low and continue to allow us to engage in those important social and economic activities and school activities that we need. We need to work together now to push our curve back down. And more than ever, we need to remind ourselves that we can do this, and we can do this by being kind to each other, by remaining calm and steady in the work that we do, and by staying safe. Thank you.
Thank you very much, Dr. Henry, and I wanted to start by acknowledging our new American Sign Language interpreter, Jessica Seegers, who's with us today and beside me somewhere. And it's great to have Jessica here with us, and I know she's going to play a really important role in helping both Dr. Henry and myself and many others communicate these briefings to people in British Columbia. I want to acknowledge that we didn't have anyone pass away in the last 24 hours from COVID-19, which is something that we always accept with gratitude. We acknowledge the 213 people who have passed away, their families, who continue to grieve in this very difficult time to lose a loved one. And so we want to acknowledge and continue to pass on our condolences to them. And to all those who've lost people in our other public health emergency, the overdose crisis, which stays with us, and of course is a source of enormous effort and work in public health, but is also a source of enormous grief and challenge in our communities. Wanted to note today, there are some changes today, obviously in the numbers. 139 is a very large number, and I wanted to note that we also have an increase today in hospitalizations, 42 cases across BC, of which 22 are in Fraser Health, 13 in Vancouver Coastal Health, and 7 in the Northern Health Authority. There is no one in hospital in Interior Health or Vancouver Island Health from COVID-19. The number of people in critical care has gone down by 1 across the province. People in public health have been incredibly busy in the last 24 hours, as they have been since the beginning of the pandemic. As Dr. Henry has said, 1,412 active cases in BC, 3,109 people self-isolating and under public health surveillance, and yesterday 5,712 tests. I think it's very important in this time, particularly as we go into another weekend of our extended summer here, of our September summer in BC, that we remember that when we're engaging in social interactions, and Dr. Henry has asked us this week to examine our social actions, that we remember to stick to six. Stick to six if you're going out to a restaurant or a bar, to make sure your group is no larger than six. Stick to six if you're hosting a small gathering in your home, and if your home is smaller, if it's an apartment like mine, less than 6. Stick to 6 when you're going out with others or having them over. Remember to choose from the same group of people, the same 6 people, not multiple groups. Stick to 6 when your plans with others outside your host household. Have a contact keeper so we can assist you and find people if you are exposed to COVID-19. Every Thursday I announce an update to our surgical recovery commitment. Between May 18th and September 6th, we completed 96,725 surgeries, 73,918 were scheduled surgeries, and 22,807 were unscheduled or emergency surgeries. That's 18,267 in interior health, 26,881 in Fraser Health, 22,302 in Vancouver Coastal Health, 19,668 in Vancouver Island Health, 5,560 in Northern Health, and 4,047 in the Provincial Health Services Authority. Last week we reported 6,088 surgeries completed from August 14th to August 30th. Health authorities have verified their data, and the total number of surgeries completed was actually 6,280. That's a significant increase over the same period last year. This week we completed 5,868 surgeries. As we noted last week, we anticipated lower completions this week and next due to planned vacations and the Labor Day long weekend, as occurs every year. The surgical renewal commitment laid out the strategies to achieve additional capacity by extending daily hours of operation, adding Saturdays and Sundays to the schedule, and opening new operating rooms where available. These strategies are being realized. For example, to address cataract surgeries, which represent almost 25% of our wait list, Mount St. Joseph's Hospital in Vancouver on the east side added 3 Saturdays dedicated to the surgery. And in those days alone, 200 cataract surgeries were completed. Our commitment to surgical renewal in BC is to keep up with the new demands for surgery and complete the surgeries lost to COVID-19. In the weeks ahead, I'll be reporting on additional progress all health authorities have made in this critical aspect of surgical renewal. I think we have to acknowledge what it means and what that means for people across the province. Every hospital, every healthcare center, public health is a community of dedicated, hardworking professionals and workers, paramedics and doctors and nurses and care aides and lab techs and physiotherapists and social workers and staff and administration and many more. A complex web of people who get it. I'm always impressed, and we've seen this on surgeries, we've seen this in public health, how they've learned, adapted, and kept on going. And and of course, patients are involved as well. I've heard and received so many letters filled with gratitude that inspires and should inspire our healthcare teams. They certainly inspire me to keep going. The woman from Vancouver Island who had her hip surgery and the impact that made on her life. You know, what really moved me was how she got it. She told me she understood we're all in this together, and she remembered that while she had to wait, and she feels and acknowledges that after she's received a surgery that was absolutely necessary for her. The daughter from Fraser Health, who told me what it was like to see her mother in her 80s at a care home, the way they could finally make eye contact in real time. She told me how at her one visit a week, she was inspired by the rules and procedures we put in place to protect people in care homes. the young family I see in my neighborhood, and the children who are excited in the neighborhood to go back to school, apprehensive, yes, and excited to get back to school in September, and all the things that they do that show that they get it. This spring, we listened to Dr. Henry and our PHO team, our provincial health team, our public health officers across British Columbia, and it meant that our hospitals weren't flooded and they weren't chaotic, and we were able to return to many of the services that we need to get to for people who have all the other things that they need help with in the BC healthcare system. And all the brave British Columbians who waited a bit longer for their surgeries are now getting the care they need. Together, we made that difference. This was our difference because we chose not to do many things. And it wasn't easy to say no. It's not easy to say no about going to a funeral or having a celebration of life of someone you love and means something in your community. It is not easy to say no to a large wedding you've planned for over a number of years. It is not easy to say no. And each one of us probably has a list of things that they used to be able to do that they'd like to be able to do it again. And hopefully we all remember in this moments what Dr. Henry has said, which is that it's not forever. Even if it feels like it, it's for now. We got it in the spring. We got it in the early summer, and we did it because we stayed close and local, because we washed our hands a lot, because we kept our bubbles small, because we did all these things. Our hospitals had the space and the time they needed. We learned, we adapted, we kept going, and we need to do that this fall. I know it's tough. I think I said on Monday that we're tired. Everybody's tired of COVID-19. We're already tired, and there is a long way to go. Well, every day I read, Dr. Henry reads, hundreds of people who contact us, and they are inspiring. Of course, not everything's perfect, and they often let me know about that as well. But all of them tell me that they get it, and they're doing it, that they're prepared to keep their bubbles really small for the fall, wash their hands and stay home if they're sick, mask up if they need to. Together we are going to get through this. This fall, let's stay small, and remember to stay 100% all in. Aujourd'hui, nous annonçons 139 nouveaux cas qui ont testé positifs pour COVID-19 pour un total de 6041 cas en Colombie-Britannique. Il n'y a eu aucun nouveau décès lié au COVID-19 pour un total de 213 décès en Colombie-Britannique. Nous continuons à offrir nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Chaque régie de santé, bien entendu, de la Colombie-Britannique compte des patients atteints de COVID-19. 2343 se trouvent à Vancouver Coastal, 3551 à Fraser, 187 sur l'île de Vancouver, 462 dans l'intérieur et 203 au nord. Il y a aussi 84 cas de personnes qui vivent en dehors du Canada. Parmi l'ensemble des cas confirmés de COVID-19, 42 personnes sont actuellement hospitalisées, dont 14 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press star 1 to enter the queue. You will get one question and one follow-up. Please also take your phones off mute. You will not be audible until your name is called. First question is from Michael Busserque, CNN.
No. Michael Busserque here I'm a contributor to CNN Opinion, calling you from Sydney, BC, up the road. Minister Dr. Henry, we have a piece up on the site today explaining how Canada crushed the curve, the COVID-19 curve, compared to the United States. And there are a number of theories why we've done so well here, including in British Columbia. Perhaps Canadians are more compliant. We're more rule followers than rule breakers. And I think there is synchronized public messaging and really to-the-point messaging from people like Dr. Henry, a very no-nonsense approach. But I'm wondering, could you summarize how the factors or the one main factor that helped Canada crush that curve compared to the United States? What was done so differently here? Thank you.
I don't know that there's one single factor, but I think you've mentioned a number of them. You know, the fact that we do have a consolidated approach across the country, that we have been through challenges before where we have worked together, where we have chief medical officers of health, my colleagues across the country who meet regularly and met regularly very early on and raised the alarm. We have that interaction with our political masters, which works in this country, in that we have that respect and that distance and the ability to speak directly to the population about health issues. Another thing I think is absolutely critically important in Canada is our public health care system, where people don't have to pay for a test, where they weren't worried that if they got sick they would not be able to get care. That to me is an incredibly important piece that we have underlying what we do in Canada. I also want to say that we have some incredible experts around laboratory testing and development of tests, and we had both here in BC but in Canada, across Canada, our National Microbiology Laboratory and our Public Health Lab Network was able to develop tests, and we used them widely very early on. So those are just some of the things that I can think of. I don't know if you address that as well.
I just think public health care is at the core of that. The fact that, as Dr. Henry has rightly said, that people have access to our healthcare system without payment. We have a single-payer healthcare system, and that makes an enormous difference. It makes an enormous difference for more than just the fact that there are millions of people in the United States that don't have health insurance. It means that we have an organized public healthcare system, that when Dr. Henry and Steve Brown started to chair our response to COVID-19, all of the health authorities were in the room, including the First Nations Health Authority, and part of that. Whereas the effect in the American system, I think, is more truncated. But all of that said, COVID-19 is an extraordinarily difficult problem in the world for all health systems in the world and for all people in the world, and we're seeing that. And the results every day, whether it's someone we lose in a care home who passes away due to COVID-19, or our case-positive tests like today, which are significant and high, and for us a single-day record. It keeps us humble. This is a very difficult challenge. It doesn't just involve public health care or health systems, but involves our entire society. And it's really an unprecedented challenge in our lifetime. And I just want to say, with respect to the United States, that I know Dr. Henry would agree with this. Dr. Henry talks to our colleagues in Washington State and Alaska all the time, for example. And there are people doing extraordinary things in the United States, and communities doing extraordinary things. And I think in a worldwide pandemic, what it tells us is that the world is interconnected. And what happens in Iran matters here, and we've shown that. What happens in other parts of the world matters here. What happens in the United States matters here, and vice versa. And that we need a world where we work together. And that's why, contrary to sometimes the popular debate where it's easy to blame institutions, we need world health institutions that bring all of us together. Because this pandemic isn't a BC problem or a Canadian problem or an American problem, it is a world problem. And we need to work together, and we can only succeed by working together to help solve it.
Michael, do you have a follow-up?
Yes, I do. Thank you for that answer. Also, Minister and Dr. Henry, you might have read today that a group of Canadian border city mayors are calling on the federal government to keep the Canadian-U.S. border closed to non-essential travel until at least next year. In the piece, we theorize that the Trump administration will probably lobby quite strenuously to reopen the border before the November election to create this sense of normalcy. I am wondering, what is your position on the border? How strenuously will you perhaps lobby Ottawa to keep that border closed for the time being, for as long as numbers, for example, in Washington State are as high as they are? Thank you.
Yeah, so obviously it is a federal issue to discuss those. We do have discussions about the things, and what we have, we early on advocated for closing the border, recognizing the risk that we were running, not just with people coming from Washington State, but because we are very interconnected, and many people in BC go back and forth and have family back and forth with Washington State, and that became a challenge for us. We've also advocated to allow family visits across the border, and we've had that implemented. I think we need to consider how we can safely move forward with additional family members. For example, right now it's quite restrictive to dependent children and relatives, and there are also many children who have adult children who have elderly relatives who need to come back and care for them or visit with them. So we need to look at how we can do that safely, how we can have some exceptions for critical functions, for some business functions, and where we have very closely monitored, so where the Quarantine Act would still apply, but there would be allowance for people to visit a dying relative or for a business function to take place if needed. And there's a number of examples that we're looking at that. But we still very much believe that visiting for recreational reasons are very risky right now, and we would advocate to keep the border closed to those.
Next question is from Keith Baldry, Global News.
Oh, hi, Dr. Bonnie Henry. Thanks for this. Just noticing the steady rise in hospitalizations, you did note it in your presentation. It's the highest number since, I think, early May or late April. We're certainly not at the 149 mark we were at the peak of this, but are you concerned that trajectory just is a steady upward climb?
You know, we've been watching it. It's actually bounced up and down. And one of the things that we watch is, length of stay, how many people are actually coming in on an ongoing basis. And so the number has sort of creeped up, but it's been different people. So there's been people admitted and gone home, and then new people coming in for periods of time. And actually over the weekend, because we weren't reporting the numbers, we were actually down quite a bit. So yes, it's worrisome. It's one of those indicators that we do watch very, very carefully, but it is also spread out around the province. So what we're seeing is, half of the cases are in Fraser Health, where we know there's a bulk of the newer cases, but we're also seeing people in the north, and that's concerning, and in Vancouver Coastal as well. So when we look at our what we presented, was that just yesterday, and we look at the impact on our health care system and on the hospitals and ICU beds that we have and the capacity we have, we're not at a point where we're concerned about that, but we know that as more cases happen, as more people become ill with this, even if they're mostly younger, we are starting to see that spill over into long-term care homes where people work, and having contact with older family members and others in our community, and that leading to people being hospitalized. So that is the warning sign for us. They go together, and we also know that even young people can get very sick with this. And as we see more young people being infected with this virus, chances are that some of them are going to get sick enough to require hospital care. And that is a concern as well.
Keith, do you have a follow-up?
Yes, you mentioned the north situation, which is my follow-up. I'm hearing increased correspondence from people up there where there was really no COVID for the longest period of time, and now I think there's 23 active cases there. There's, I think, 5 or 7 people in hospital, and of today's cases, I think 7 are from the north. So is that still tied to that religious event that occurred in Alberta? Is that a continuing spread from that particular situation, or is it more widespread than that?
Yeah, there's a couple of clusters that are related in several areas of the north. There are still a good chunk of the cases that we're seeing, the active cases as well as the hospitalizations, are related to people who transmission that happened at a large religious event in Alberta, as you mentioned, and people came back and unfortunately spread it within the community before it was detected. That is mostly under control, but what we're seeing right now is people who were contacts are now in that part of the incubation period where they're getting sick. What we are thankful for is that we found the contacts, and we're confident that there's not going to be another generation from those exposure events. But there are a couple of clusters and exposure events that happened in various areas in the north. And yes, we're watching that very carefully. As you can see, 23 cases doesn't seem like a lot in many communities, but we know the north is stretched, and the resources that we have in public health to follow up with everybody is being stretched. They're working very hard, and we're working very closely with communities to make sure that we can support them in supporting individuals who are either being on isolation because they're positive, or people who are in quarantine still right now and being monitored.
Next question is from Srushti Gangdev, CKNW.
Hello, can you hear me?
Yep.
Hi, sorry. We're hearing a lot about long haulers or people who have had COVID-19 symptoms for like months after even potentially recovering. I'm just wondering if BC is engaging in any specific local research on whether that's a concern here, if you have a ballpark number of people you're monitoring or anything like that.
The short answer is yes and no. We are, and we have been aware of that. And there are a couple of clinics in the Lower Mainland who are following people, and that information is being captured as part of both ongoing clinical management and support to people, but also so that we understand the longer-term impacts. And I will say it's absolutely true. And we've seen, as you know, we've had an increase in younger people who are being infected with this, mostly who have mild illness. But we are learning about this virus, that it can have effects that go on for some time, particularly on the heart, on the blood vessels, inflammatory conditions that can cause symptoms, shortness of breath in particular, and fatigue, a profound fatigue, not just I'm feeling tired today, that can last for many months. Well, we only know for months or weeks and months right now. What we don't know, and this is where we've been watching the research around the world on this, we don't know if this is something that is going to gradually get better over a period of months to a year, which is something we do see with other viral illnesses, severe viral illnesses, or whether this is something that's going to cause long-term impacts on some people. So that's the challenge. I know it's extremely frustrating. The people I hear from who were positive in March and are not able to get back to their usual activities and the usual things that they do. I don't have a number of people who are involved in the research that's being ongoing, but I know there are a couple of projects that are working at that, and we funded them. There was just last week we had our second 2 days of research symposium that is mostly funded through Michael Smith Foundation and led by UBC and Simon Fraser University, and an incredible partnership that we have here in BC that's really, I think, led the country and us being able to understand many different aspects of what's happening in BC and linking to what's happening in other countries around the world. And part of that is things like some of the therapeutics and the vaccine initiatives. Some of it also is looking at clinical management and follow-up of people who have COVID-19 here in BC.
Do you have a follow-up, Sruchi?
Yeah, just wondering if there's any concern that long haulers would kind of not take up resources, but continue to use resources from the healthcare system. And if 2 months after developing symptoms, are they able to continue back with their lives, go to work and go to school and things like that, or should they still be at home?
Yeah, well, it depends. And obviously, these are things that we're learning about, and every individual situation is the same. We know that some of these are associated with COVID. We also know that we had a lot of influenza circulating at the beginning of this pandemic. And influenza also is a disease that can flatten people for quite a long time. So it's challenging sometimes to tease apart what people might have ongoing issues with, and that's where the research becomes so important.
Next question is from Marcella Bernardo, News 1130.
Hi, everyone. I wanted to ask for some clarification because, Dr. Henry, earlier you said that there's 642 cases of COVID-19 recorded in the Interior Health Region, and that's 180 jump from yesterday. So I don't know if the numbers might not be correct, because if they aren't, 180 seems like a lot.
No, I must have misspoke that, because it's 462. Sorry.
So that hasn't changed from yesterday?
No, there's no new cases in the interior today.
Do you have a follow-up?
Apologies for that.
Yeah, and then my follow-up would be regarding all of this discussion in the past couple of days about banquet halls and what qualifies as a banquet hall and what doesn't. Are you clarifying now with various places that don't consider themselves standalone banquet halls as to what they are allowed to do when it comes to your new public safety order?
Yes, and my office is very busy doing that. It's a category that we have been aware of issues related to, and you're right. It's not people who are. It's not for the most part small parties that are following the rules in places like hotels. It's not small clubs that have some banquet rooms. It is really, and we've mentioned this over the last couple of weeks, we've started to see that there were parties being held, sometimes multi-generational parties for great celebrations, and they were sources of transmission of this virus in many different situations. We put the word out. My colleagues in public health have been working with their local bylaw officers and others to make sure that we gave the word to people that this was a setting that was a challenge, and that we were seeing cases that were difficult to trace, and that was one of the things that triggered us moving ahead with this. You know, we've talked about exposure events at some of the parties and banquet halls, as well as at nightclubs. We've worked with both industries to try and put in place the safety protocols, but we've had increasing and continuing exposure events that have led to more transmission, as well as second-generation transmission from people who were exposed to those who were at these parties and events. And it's taken a tremendous amount of public health time, particularly in the Lower Mainland. There are also, though, issues from all of my colleagues, and before we put this order in place, we had discussions around the province, and it was not just a local issue, which is why we responded with a public health order around these specific areas. But yes, we are working out the details so that everybody knows exactly which is included and which isn't. And it really is to try and focus on the areas, the venues where we know there have been problems, where we know there has been transmission. And quite frankly, it's been a challenge. And I've had correspondence with the Banquet Hall Association around this. We have said consistently from the beginning that 50 is our limit, but when you have a party and it goes late, and people want to have others there, and they just bring people in, and it makes it very challenging for the owners and operators of the facilities to keep the environment safe and to ensure that we're not giving the virus a chance to transmit. And unfortunately, that wasn't able to be managed in a way that reduced the risk to the rest of our community. And that's why, as a last resort, we've put in these orders.
Graham Wood, Glacier Media. Okay, moving on to Richard Sisman, Global News.
Henry, you mentioned at the beginning of the briefing around the notifications of a case of COVID in a school. Can you make it clear around what happens if there are a few cases in a school? Is that notified on a website? Is British Columbia considering doing something like Alberta does and tracking school cases online so the public can see those cases? And then what qualifies for a school outbreak compared to just a case in a school?
Sure. And these are we have a protocol that if it's not up yet, it will be on the BC CDC website around this. So we are looking at several different scenarios. We know that there's likely both adults and children right now, because we have transmission in our community, who may have the virus and may develop the symptoms and become sick when they're attending school or at home before they go into school. That's why it's so important that we have our screening in place, that everybody must check themselves for symptoms before they go into school. And that includes the teachers, the administrators, everybody. And we need to make sure that we have those, that we avoid those close contact situations in the school setting where we might transmit this to others. But I'm getting away from myself. So we know that we'll have cases that pop up. And we've seen that in other provinces where school has started as well. And these are people who are exposed either through social contacts, through family contacts in the community. If there's no transmission event in the school, or there's no exposure when somebody is infectious in the school, then That is not considered an outbreak. That's not considered a school case. We will, and local health officers will be working with every school so that every school family, school community is aware that there's cases, that there may be a case in their school. It may not require anybody else to stay home. If there is a possible exposure, it may be that some of the learning group may have to be quarantined for a period of time, depending on what type of exposure happened, how many people had close contact, and that'll be part of the investigation that each health authority will do with the school. An outbreak would be when we see transmission between people in the school setting, where extra additional measures have to take place. And that's what we will be reporting on publicly to everybody when we have an outbreak, if and when we have an outbreak in a school. And that's what we'll be focusing our measures on, making sure we prevent those from happening.
Richard, do you have a follow-up?
And beyond that, Dr. Henry, is there a timing for when a school may be closed or a cohort may be required to isolate? And in the worst case scenario, is there something in your mind that would lead to the system having to close down like we saw in March?
Yeah, I do not foresee a situation where the system would have to close down. That would mean that we were in dire straits in many other aspects of our community, and that's what we're trying to absolutely avoid. I do see there's a couple of scenarios where we may see schools or groups of people having to self-isolate or close. So it'll depend on the investigation. The scenario that I could see happening would be if there was multiple exposures or transmission between adults in a school setting and there wasn't sufficient staff left to safely operate the school. We've seen that happen with influenza outbreaks. We've seen that happen in other parts of the world where schools have reopened, where the teachers are getting together and inadvertently, I mean, people don't do this on purpose, but where they can transmit the virus between each other, and then others would be in an exposed situation, so they would have to be home and quarantined. So if that happens, I could see potentially a school having to close. And those are the things that we want to avoid by making sure that we're doing the right things to prevent that type of scenario from happening. In terms of in a school setting, if a teacher or a student was sick with the virus, it would be an investigation to determine exactly who they had contact with that could lead to the type of exposure that would lead to transmission. So that's what we do in public health with our contact tracing, and we'll be doing that with every single case in each school.
We have time for one more question. For everyone listening today, Dr. Henry and Minister Dix release a joint statement every afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For medical guidance on protecting families and communities, and for access to provincial guidance on COVID-19, visit bccdc.ca. And for information about the province's pandemic supports, visit gov.bc.ca/COVID-19. Last question is from Tina Lovegreen, CBC.
Thank you so much. Dr. Henry, the World Health Organization recommends waiting to open schools until there are 2 weeks without infection rates below 5% in a community. Fraser Health numbers right now are at 6.13. What's giving you the confidence with the COVID infections rising that it's okay to mix students 1 meter apart?
Yeah, that's one marker that the WHO refers to, and that was a single day where we had lower numbers of tests. So it's not one that I use as an absolute cutoff. We've talked about this a little bit before. We look at numbers of cases per day per 100,000 as a measure of community spread. We look at cumulative numbers of cases, and we presented that data last week, the cumulative incidents per 100,000 in communities, and we're well below any cutoff in all of our communities around BC right now. We still have very low community transmission on a relative basis. So % positive reflects a number of different things. It reflects the number of tests done, but it also reflects that we focus our testing in BC on people who have symptoms. And that should be a higher pre-test probability that you're going to be positive for COVID, because we are directing people who've had exposures as soon as they develop any symptoms to be tested. So to me, actually, the fact that with the numbers that we have and the people that we know are contacts being tested, that's actually reassuring. It means we're catching people.
Do you have a follow-up, Tina?
Yes, please. Just wondering if there was ever a regional approach to school reopening ever considered.
I think what we have is what we've done with every other industry that's reopened, is we've put the parameters in place. We've said, here's the things that you need to do across the board for schools, and then every single district, every single school is putting in place their plans for what they need to do in their setting. And yes, if we have an outbreak in a school and the local public health analysis and response to the outbreak means that a school might have to close, then that would happen for that specific school. But the overall approach that we're taking to how we're managing COVID and making sure that children get the necessary educational experience that they need is the same across the province.
That's all the time we have today. Thank you.
Thank you.